Health disparities among African Americans. While the spotlight right now may be on the disadvantages African Americans face while fighting the novel coronavirus, we are also disadvantaged throughout the healthcare system when combating other diseases. Compared to our white counterparts, African Americans are generally at higher risk for heart disease, stroke, cancer, asthma, influenza, pneumonia, diabetes, and HIV/AIDS. According to the Office of Minority Health, part of the Department of Health and Human Services. One possible contributing factor, the CDC, or the Center of Disease and Control and Prevention, says that African Americans are more likely to die at early ages for all causes. To as young as children, when it comes to African Americans, have these typical diseases that other races have when they're older. For example, high blood pressure is common in 12% versus 10% of black versus whites aged 18 to 34 years, respectively. It is common in 33% versus 22% of those aged 35 to 49 years, respectively. Diabetes is common in 10% of blacks aged 35 to 49 compared to 6% of whites. And stroke is present in 0.7% of blacks aged 18 to 34 compared to 0.42 of whites the same age. Stroke is common in 2% of African Americans compared to 1% of whites aged 35 to 39 and 7% to 4% respectively in those that are aged at around 40 years old. I'm Dr. Zarif, the nutritionist.